Okay, so I will speak in English, and if I see any problems of translation, I can try to translate into Portuñol. I am Portuguese, but my Spanish is a bit complicated when it comes to presentations of this kind. So, first of all, I would like to thank the opportunity to be here. It's a great honor, especially after such brilliant presentation of Professor Monteagudo. Second, I'd like to note that many years ago I've worked for Tunstall. That's the main sponsor of this conference. I worked at the International Marketing Department in England, and one of the challenges we had at the time was to understand the Iberian market. And I had the opportunity to undertake a market research for Portugal and Spain. And at the time, and it's been many years, I don't want to say how many, it's been quite a while, but at the time the results were that Tunstall had a great future in Spain, and Tunstall had no future in Portugal. Now, Portugal is my country, so I was very sad to actually come to that conclusion. The question was related to the social security system, and how in Spain the local government and the social security was able to finance some of the technology at the time we were trying to bring into the Iberian market. So it's very interesting. It's not a sort of full circle, but it's quite interesting that I'm here now at a conference sponsored by my first real job, in fact, because I had just finished my PhD at Manchester University when I started working for Tunstall for a few years from then. So it's a curiosity, but it's actually linked to my presentation, and this is why I mention it right here in the beginning. I'll take you through three topics. First of all, when we discuss governance and health policy development and health systems development, we do need to clarify some of the basic concepts that we are working with. Then we'll look into the European health policy objectives and main ideas for the 2020 agenda. And finally, I'll identify some concrete dimensions for e-health governance. One of the interesting things that I've seen evolving internationally was that when I started many years ago at Tunstall, there was this concept of telemedicine. And a few years later, the telecom industry started realizing that telemedicine is not a good concept for them. And so they started opening up the concept. And this is why in many fields or subfields of this work you're doing, I have seen that the concept of telemedicine has been dropped. And we have seen the introduction of e-health. E-health includes telecare, telehealth, and telemedicine. Now, telemedicine became one part, important part of e-health, but it's no longer the leading concept. And this may not be very important for you as professionals, but it is strategic for the telecom industry. It has been the way that the telecom industry was able to bring in other professionals. Again, this is something for a debate if we have time for that. And being not terribly important in many health systems, it has been quite a change within the telecom industry. And we will see why that is so important soon. So, first of all, we tend to look at, and I'm speaking as an editor of the International Healthcare Management Journal and also of the Imperial College Press. I'm scientific editor for the Imperial College for a book collection, and I would very much like that to have some telemedicine books from Iberian or from South America. So I'll leave the little note here in that regard. We have to look at the healthcare cycle to understand where e-health, including telemedicine, has its potential. What we see in many conferences like this in different parts of the world is examples of work, very good work, undertaken by healthcare professionals in 2 or 3 of these areas. Let's call it of these moments of the healthcare cycle. Monitoring and diagnosis, it's the most common field, or let's say are the 2 most common areas where we see a lot of pilot projects led by healthcare professionals. We don't see that much on advice, although that's broader. Treatment, we have, of course, a lot of examples. When it comes to rehab, we also have examples and technologies and so on. When it comes to prevention, then we identify that it's a whole different field. But what this model allows us to think is when we look at this from a strategic governance point of view, we realize that there are 2 perspectives in Europe, certainly not just in Europe. One is that there are many professionals with a lot of goodwill and concentrated efforts that want to do more of the same business as usual, using the new technologies. This is an approach that, from the telecom perspective, is quite challenging, because the several industries that are developing solutions don't really like this approach. When professionals start looking at technology and thinking, okay, how do I do my work as I do it now using this technology? And of course, it's acceptable and it's agreeable, but from the industry perspective, this is not really what they understand that will make the whole process grow. There's also a different perspective, which is what we've just seen by Professor Monteagudo: rethink healthcare for sustainability, responsiveness, and higher quality. Now, this is, of course, the focus of the let's call it the technology-related industries. They're not really happy with the first perspective, although in practice we realize that that is the perspective that within most health systems is the most usual perspective. So we have a challenge here. When we come then to thinking about e-health governance, it's always good to go back to basics. And one of the things is that there are different perspectives related to e-health, including telemedicine. We have the medical perspective, which can be summarized in this way. In a sense, the individual activity of doctors, which is the traditional way of working in many health systems, assumes that they will establish some sort of e-health station related to their individual practice and adapt or connect all sorts of technology. This is one perspective. Again, it's acceptable and agreeable, but it's quite different from the perspective of the manager. The manager looks at e-health and he sees quite different potential utilizations, if we call it that. And we can see here some of the key concepts which have been used for some analysis in some countries. So when we probe into managers' perspectives, we realize that they go around this. So they see health and e-health has a good contribution for a combination of these management efforts. Then we have a third perspective, which is what we call the health system perspective. The health system perspective is, of course, much broader, and I'm not going to read through, but as you see, it suddenly looks into the whole system, and it connects with a number of dimensions that I think the Rivendell scenario of Professor Monteagudo was more into. Now, I would very much like to live in Rivendell, except for the years, which I wouldn't like to have those. But generally speaking, this third perspective of the health system perspective is quite complex as well. So it's not a big problem, but to have these perspectives. What we sometimes have to realize is that, for instance, in the journal that I run, we get a number of papers related to health from different countries in the world, and they come from these three perspectives, which is quite interesting. We get papers with all of the three. What is sometimes not very clear is when people are thinking, for instance, about a national strategy. I have seen telemedicine or e-health national strategies which actually take one of these perspectives, and that is for a country, for a health system, that is quite challenging. I mean, if we look at a national strategy for developing telemedicine from a medical perspective only, this strategy is going to have problems. It will be quite limited, as well as when we see strategies that have been designed from the manager's perspective. Obviously, the health system's perspective is more complex, is more challenging. It's much more difficult to develop a national strategy based on the health system's perspective, but it is necessary. Otherwise, we realize a number of problems which we will look at now in the second part. So from Europe, we get this Europe 2020, which everybody's talking about. And one of the things that I would like to challenge you with, maybe for the debate, is to what extent there is something really different in 2015 and 2005. I mean, I didn't want to go earlier. I could go actually 20 years if so, but 10 years is enough to realize that if we think about what has been changing, I mean, as we have a perspective of what was available 10 years ago in terms of technology and the adoption of innovation in health systems, and 10 years later, we see that in many health systems, nothing much has changed. There have been a number of pilot experiences, pilot experiments, but not much has changed in terms of the health system perspective, which is something quite worrying from a perspective of governance. There are 8 topics or practical questions that have been identified by the European Commission, and are of course common challenges for many health systems outside Europe. So one of them is the cross-sector cooperation, and I've seen and heard a number of papers at this conference that actually identify this challenge or this problem. We have to know the main barriers. These are very practical questions. Some of them are complex, but when we say cross-cooperation for integrated care, we have again to remember the healthcare cycle. There is no integrated care if we don't realize that the intervention has to look at and be covering all the healthcare cycle moments. Learning together is another challenge, so of course forums like this are quite important for that, and they should be further developed and supported. Then the idea of learning organizations is quite important. So within e-health there have been a number of pilot projects in many countries. I know of course some in Spain, in Portugal, and other countries which I've seen from the Tunstall experience even so many years ago. And what I realize is that many of the pilot projects do not promote much learning, because people don't publish, and then the skills developed in the pilot sometimes just disappear because there's no more money for the project closes, and the people have used that technology and we have learned, they disappear from the system, and 5-7 years later there's new people starting the very same project, okay, with another brand technology. So instead of being Tunstall, it's now Siemens, but the fact is they're doing exactly the same as they were trying to do 5-7 years ago with different people, and no learning process has occurred. This is something that we have realized in many European countries, and that maybe you have done so also in your countries. The stakeholder involvement and industrial partners is another practical question. This is where things can move very quickly, because the industrial partners are quite keen on getting involved, on working together, and most of the pilot projects actually happen because the industry pushes them forward. And that is, of course, something also very practical. 4 more questions. The training and education, which has been a topic several times referred here. Another challenge, and this is something that it's quite worrying, because it's been quite a few years and we still face difficulties to show the impact of e-health technologies, telemedicine, telecare, telehealth. Now, there's been, of course, a number of attempts. There have been many studies, lots of research, but we haven't been able yet to come up with a model of assessing impact that is widely accepted, essentially to influence decision making. So we have obviously the industry trying to show that you can save millions of dollars or euros or whatever, but we need impact assessment from the healthcare perspective, from the quality of care, from the quality of life, and that is something that it's happening now, but it's more recent, and it's quite a challenge. Financing challenges, always a problem, always a challenge, and then, of course, identifying the key needs for citizens. What I would like you to look at now, just to close, is so what new dimensions do we have to look at when we're thinking about governance in e-health, including telemedicine? The first question is, okay, so we can have a connected patient or a connected citizen, and of course there are many ways of connecting patients, and these are just examples of the gadgets that are available. Every month there's a new one, a new version of the same, or completely new. Yes. Then we have the challenge of a connected health system, and so we need to ask what is going to happen, and how the governance process will lead the present and the future. Now, a connected citizen is essentially when we see innovative developments from outside health systems. So even iPhones and Apple are contributing to this. Now, what's happening as a trend is that we're seeing that the connected citizen is connecting itself to wellness, and the connected health system is apparently developing innovative developments towards patients. So this leads us to think, of course, about what will be the governance emphasis in the future. Will we allow or develop and support the connected citizen or connected patient or a connected health system? And what we're seeing is that the telecom industry and other partners, when they look at the health system, they have been looking at the health system for the past 20 years, and they realize that it's extremely difficult to change the health system to adopt the innovation and the whole potential. So they've turned to the consumer. And within this perspective of consumer and approaching this to the wellness industry and the wellness approach, they have we have seen that this is where things are happening. And we will see what impact this has in the health system. And it's not very clear. I think the health system in many countries is closed, and it's not realizing that the whole revolution is happening outside the health system. It's becoming a consumer issue, and that is, of course, very powerful, and it is kind of worrying that the health system is being closed in itself, is not realizing that the connected citizen is not a connected patient, and that e-health is not e-disease. But then again, WHO, World Health Organization, has been saying that for the past 40 years, that health systems should be geared towards health and not only disease. And when we see a lot of developments within telemedicine, what we realize is that we're not talking about e-health, but we're talking about e-disease, which is, again, fair enough. And WHO still claims or suggests that positive health approach is not the same as disease approach. And we're seeing that the two concepts are still there and related to the whole world of e-health. And having said that, so this will again lead us to ask: is there something really different between 2005 2015? And we can say that when it comes to a connected citizen, definitely yes. In 10 years, a lot has changed. A lot of behaviors in many countries are now changing. I lived in Sweden for a few years, and I've seen how people in Sweden have become a connected citizen to their own health, using all sorts of technologies and gadgets, and improving their health literacy levels and so on. What I've seen in health systems generally, I'm not just talking about my health system in Portugal or Spain, is that not much has changed, not much change in 10 years. And this is interesting, I hope, for debate. So thank you very much.